Ohio Network for Health Coverage and Enrollment. And just a disclaimer, the information provided in this webinar represents current knowledge of implementation and is not considered legal advice. And as you know, implementation of the ACA and Marketplace are ongoing and therefore is subject to change or further clarification. And for most recent information, visit healthcare.gov. Just a few technical details. Click the red arrow button to minimize and maximize your screen. And the most important box that you need to know about is the questions box. If you have any questions throughout the duration of the webinar, please type your question or comment in the questions box and I'll see them, and we'll have some time at the end of the webinar to answer any questions that you have. So just some general housekeeping. Like I said, the comments box, we will have a copy of this PowerPoint available on UHCANohio.org. We are recording this webinar. This is a close call to the media, and we will send a follow-up email with the PowerPoint probably Monday once the recording is uploaded to our website. So our presenters today are Kathleen Gmeiner from UHCAN Ohio, Henry Moeller from UHCAN Ohio, Mary Wachtel from Health Policy Institute of Ohio. We also have Jack Reat from the Ohio Association of Food Banks, Deanna White from the Legal Aid Society of Southwest Ohio, and Tricia Brooks from the Georgetown University Center for Children and Families. And I'm going to turn it over to Mary, and she's going to talk to you a little bit about ONCE, and then we'll get started with the content of the webinar. Mary?
Thank you, Alyssa, and good afternoon, everyone. My name is Mary Wachtel, and I'm with the Health Policy Institute of Ohio. I just wanted to say a couple of words about the sponsoring organization for today's webinar, which is ONCE, which stands for the Ohio Network for Health Coverage and Enrollment. And this is a collaboration of sorts of organizations from all across the state who share an interest in the issues of helping uninsured Ohioans learn about and enroll in new coverage options. We started meeting together in early summer of 2013 and are continuing to do that through the balance of at least this year. The purpose of the network you can see in front of you is to ensure that our efforts are coordinated and effective so that all uninsured Ohioans understand and enroll in health care coverage. This is a special project of the Philanthropy Ohio Health Initiative, and my organization, HPIO, helps to convene the network. I want to say thank you to our many, many partners, especially to our partners today who put together this webinar, especially at UHCAN, who's managing all of the behind-the-scenes stuff, and other presenters. The ONCE Network provides timely information and updates for people like you who are helping Ohioans enroll. We generally meet monthly in Columbus and always offer a call-in option for our meetings. If you aren't involved yet and would like to be, the next slide includes some contact information for how you can reach out to my colleague here at HPIO who helps to manage this project. So we look forward to a productive conversation today, and I'll pass this on to the next presenter.
All right, and we're going to take a quick poll, and the question is, have you been asked to help someone apply for Medicaid? I'm going to launch the poll, and then you can click your answer. All right, I've launched the poll. Your options are, yes, I was able to help them. Yes, but I was unable. Maybe you had trouble helping them. No, but you will be asked in the future. Or maybe you haven't been asked yet to help with Medicaid. Just select your answer, and then I will close the poll. Looks like people are responding. Give you a couple more seconds. All right, thank you. I'll share the poll results. So it looks like about 34% of you said yes and you've been able. Next comes 29, no, but you will be in the future, followed by no and yes, but maybe you had some trouble. So it looks like this is great participation in this poll. Thank you for that. And I'll hide the poll and we'll continue on. Kathleen?
Okay. Well, The purpose of today's presentation is to give you a simple overview of who is eligible for Medicaid and how new rules differ from old rules. We plan to provide information on related issues such as what income counts, eligibility of immigrants, and the relevance of assets. There'll be a live walkthrough of enrollment on the benefits.ohio.gov website. We'll discuss filing an appeal and briefly cover the responsibilities of people who help with enrollment. The expanded Medicaid became effective in Ohio on January 1st of 2014. There's 275,000 Ohio adults who are expected to be eligible under these new eligibility criteria. Originally, through the no wrong door policy, we expected that all enrollment would be done through healthcare.gov, but because of some of the federal electronic communications issues, people who applied for Medicaid through healthcare.gov or simply applied for a benefit and were told by healthcare.gov that they probably qualified for Medicaid, that information has not been effectively communicated to the state in a way that would allow for automatic enrollment of all of those individuals. So now people are being directed to file for Medicaid applications separately in Ohio, either using the state website or going to their local department or the 800 number that the state has created. There is no special certification that's needed to assist people to enroll in Medicaid online, such as the certification that the federal government currently provides to people who are helping with the marketplace. However, there are people who are the people who are providing assistance are still asked to adhere to certain requirements that we'll talk about later. And the federal government will reimburse Ohio at the rate of 100% for the first 3 years, and then by 2020 it'll phase down and stay at a 90% reimbursement for what Ohio spends for these newly eligible persons on Medicaid. Now, who are these newly eligibles? Well, basically, any Ohio adult with income no higher than 138% of the federal poverty level who has lived in the United States as a legal permanent resident for at least 5 years, and there are some special requirements, special permissions for women who are pregnant. We'll talk about that later, and is not eligible for an Ohio Medicaid category in existence as of December 31st, 2013, such as having been eligible under Parents' Medicaid. So children are eligible up to 200% of the poverty level, parents up to 90%, pregnant women up to 200%. These are all the older categories, age blind and disabled income up to 74% of poverty. And these individuals are usually considered those with a spend down. And now they have a choice to be part of the newly eligible, and they don't have to meet that spend down every month like they have in the past. So what is the difference? Well, the difference right now is that the amount of reimbursement that Ohio gets from the federal government, and later there could be some benefit differences, but there are not at this time. So this is just a quick chart to show you the the categories and where the poverty levels fall. You'll notice for a couple of them, like children, 211% of the federal poverty level, and pregnant women, 205%. These are adjustments that have been made at the federal level, but they're basically the same categories as we've had before. The income and federal poverty levels include a 5 percentage point disregard. That's why we say 138% for the adults and other adults and parents. An unborn child, and there can be more than one unborn child, is counted in a pregnant woman's household. Now, generally, eligibility is the same for the Medicaid newly eligibles and the advanced premium tax credits in the marketplace, but there are some differences. For example, if you have an individual who is a tax dependent of someone other than the spouse or the parent. For example, a child lives with his 51-year-old grandmother, claims the child on her taxes, and the child has no income. Well, the child is a household of one, and only child's income counts, but only if it's above the tax filing threshold, which is somewhere around, like, I think $6,000, but I don't think we have that slide in here. So as you can see from this chart, in the Medicaid household, you have a household of one for the child. The grandmother's household is two, whether it's the Medicaid household or the premium tax credit, i.e. marketplace household. There's a second exception, a child under 19 living with both parents who are not married. So let's say the child lives with the mother and the father, but they file their taxes separately because they're not married, and it's the father that claims the child. Both parents count toward the child's household size of 3. So the child, it's the child, mom, and the dad for Medicaid, but in the marketplace, it's the child and the dad in the child's household. The mom is going to be the same, and the dad's going to be the same, whether it's in the marketplace or Medicaid. And there's a third exception, a child who's under 19 and expects to be claimed by the non-custodial parent. So let's say the child lives with the mother who does not live with the father and files taxes separately. The father claims the child on the taxes. Well, the child's eligibility will be based on the mother's income and household size of 2 for Medicaid purposes. Still a group of 2 for the marketplace, but there it's the child and the dad because it's the dad's taxes that the child is a dependent. For the mom, it's going to be the same for Medicaid and the marketplace, and it's going to be the same for the father, in whether it's Medicaid or the marketplace. So there are some notable changes as to what income counts. And Medicaid, before December 31st, the child lives with a parent and step-parent. The step-parent's income did not count. But now the step-parent's income does count. Formerly, if the mom's income is from the job and child support, the child support counted. But now the child support does not count. And previously, legal permanent residents, adults and children, were eligible if they have been in the U.S. for 5 years, plus have worked 40 quarters, or if children, their parents have worked 40 quarters. But now, children and pregnant women who are legal permanent residents are eligible for Medicaid without a waiting period. Adults who are legal permanent residents are eligible once they've been in the U.S. for 5 years. So basically, the 40-quarter work requirement is gone. Now, something that a lot of folks aren't even aware of, for the MAGI categories, and that's all of these categories we're talking about here, the children, the parents, the newly eligibles, there is no asset test. However, there is an estate recovery provision in Ohio. Medicaid services received by Medicaid recipients age 55 and older are subject to estate recovery. And that means that the state of Ohio can go through the court after a Medicaid recipient has passed away and seek repayment from the deceased recipient's assets for money spent by the Medicaid program. However, there are protections for the surviving spouse and certain other family members. Ohio is one of the states. A recent poll was done by an individual from Consumer Reports of the states that had such provisions in their statutes to see whether they intended to apply them to the newly eligibles. And Ohio said it does plan to apply it, although we don't know exactly what that's going to look like. And so because we now have 2 ways of helping people to apply for coverage, the healthcare.gov for the marketplace and benefits.ohio.gov for Medicaid, it's important before you go way down the road on setting up an account in healthcare.gov that you have an idea whether it would be better to start with the Medicaid. And so the first thing you do is you say, well, who is applying? and who is in that person's household. Based on household size and whose income counts, is that person's current household income no higher, or at least pretty close to 138% of the poverty level. And we say pretty close to because sometimes things, once you go through an application, you find that things may be just a little different than you understood when you started out. Is the adult applicant a citizen or a lawful permanent resident for at least 5 years, except children and pregnant women, of course, are not held to the 5-year requirement. So if you answered yes to questions 3 and 4, then use Ohio's Medicaid application process. And so now I'm going to turn it over to Deanna White from Legal Aid of Greater Cincinnati. Deanna?
Yes, thank you. Can you hear me?
Yes, we can hear you.
Okay, great. Thank you, everyone. So you've gone to www.benefits.ohio.gov after making that assessment that Kathleen just went through. You've applied for Medicaid, or you've assisted someone in applying for Medicaid, and now I want to talk about what you can expect once you submit the application, whether it's by paper or over the phone or online. The County Department of Job and Family Services has 30 calendar days from the date of application to issue a decision, whether it's an approval or a denial. They have 30 days to make their decision, and if you want to check the source on that, I've written down the Ohio Administrative Code site for that. And what you should receive in 30 days is a letter that looks like this, without all of the black marks. It's a notice of action, and in this case, this person has received a negative action. This person is on the notice date of January 24th, 2014, has been notified that Medicaid has been denied, that no one is eligible for MAGI-based Medicaid based on that administrative code regulation, and that the reason they were denied there at the bottom is because the individual is over income. That's page 1 of the notice. The next slide shows the last page of the notice that they receive tells an applicant what they can do if they disagree with that decision. So you wouldn't disagree with an approval. You would likely disagree with a denial. And on the next slide kind of chops this up into bite-sized pieces as far as what applicants can do. This is page 5 of the decision, of the notice that people receive. They can ask for a state hearing. They don't have forever. They can't wait forever to request a hearing on a decision with which you disagree. As I've highlighted in yellow, you have 90 calendar days from the date the decision was mailed to you. And then the little red arrow points to where you can find that date. The pink section outlines the common reasons why someone would want to ask for a hearing. The first one is tricky. You can request a hearing if you've applied more than 30 days ago and you haven't received a decision on your application, but you won't have received one of these notices because that's the whole point. You haven't received a decision. But I can tell you all as advocates that you can tell your patient or client that if they haven't gotten a notice of decision within 30 days, they can request a state hearing by calling the Bureau of State Hearings. And it's at 1-866-635-3748. I'll say it again, 1-866-635-3748. After the client or the patient calls, they can say, I applied for Medicaid on December 9th. Today's February 7th. I haven't heard anything. I want a hearing. The second reason in the pink box why you would request a hearing is if your application was approved, but somebody in the family was left out of the decision. So the notice would say, you know, Jane and John got Medicaid, but we left off little Bobby. You could also request a hearing if your application was denied. You can request a hearing if this notice says your Medicaid is terminated. You can request a hearing if you were denied a particular service that you think should be covered by Medicaid. The green section tells how clients, patients, authorized representatives can request a hearing. I recommend either calling or emailing your request to the Bureau of State Hearings. Email is our personal favorite because you have a record of the copy of the date of your request. And finally, you can ask a local legal aid program for free help with your case by calling that 1-866-LAW-OHIO number. If you go to the next screen, I just want to put in a special plug for the counties in the Legal Aid Society of Southwest Ohio. If you're on this call from Brown, Butler, Claremont, Clinton, Hamilton, Highland, or Warren counties, you can call us directly at the number on your screen.
Great. Hello. This is Zach Reat with the Ohio Association of Food Banks. And I'm going to be talking to you a little bit about when to assess using benefits.ohio.gov and healthcare.gov in the context of Medicaid. As you know already, healthcare.gov and benefits.ohio.gov are not communicating effectively, at least in terms of transmitting cases from one system to the other. So a person who may be Medicaid eligible should use benefits.ohio.gov to submit their application. It should be noted that there are other ways for people to apply if they're unable or unwilling to use the self-serve benefits.ohio.gov portal. You can do that by calling the Medicaid hotline at 1-800-324-8680. Representatives on that hotline will collect basic demographic information. They'll then transfer the case to a caseworker who will take additional information from the client but may not completely process the case. In fact, in a lot of cases, the information will be transmitted to the County Department of Job and Family Services, where the consumer can follow up with a caseworker for additional to submit additional information if necessary. And then finally, a person can apply at their County Department of Job and Family Services office. They can show up in person, and they can show up with an application that they've completed, pulled off from benefits.ohio.gov. And I'd just like to quickly take a moment to say thank you to all of the County Department of Job and Family Services offices that are represented on the webinar, and those that aren't. We know that you all are experiencing just an incredible demand right now, and that all of the technology glitches are pushing some people through your doors that maybe weren't anticipated. And we just so thank you for your efforts and hope to work with you to resolve all of the glitches here. On the next slide, we have some information about requirements for people who are going to help with the Medicaid enrollment. Basically, there are no stated requirements for people that want to help individuals through the benefits.ohio.gov portal. However, it is strongly recommended that before you help a consumer to use the website, that you watch the tutorial that's available on benefits.ohio.gov. Soon here, we'll be going through a live walkthrough of the website, but again, strongly recommended that you watch that entire tutorial before actually assisting a consumer. The last thing I'm going to talk about before turning this over to Henry for a live walkthrough is just a few tips. First, know that the system is self-serve, so do not assist multiple consumers from a single client account. You must create a unique client account for every applicant served. Be sure that you're filling in as many fields as possible. Not all fields are required, but it's strongly recommended that you submit as much information as possible. We also just today got some feedback from some caseworkers that are trying to process these cases on the back end, and they're telling us that many of the applications that are being submitted are difficult to find because of typos in the Social Security number or the name or other information that's submitted. So as an assister, please be very careful to make sure not only that the fields are completed, but that they're that spelling is correct, that you're entering the right numbers and that sort of stuff. In the income field, and this came straight from a representative at the Ohio Department of Administrative Services, entering at 0 as an income is simply not working. Also, leaving the field blank is not working for individuals with no income. So their recommendation was to use a value between $1 and $5 if the income, if the individual has no income at all. And then finally, and Henry will touch on this a little more, if you do experience trouble moving through the application, consider trying a different internet browser. As improvements are made to the system, oftentimes new glitches will appear, and it may be that those glitches will only run into those glitches in certain browsers, so that's always a good first troubleshooting step. And now I'm going to turn the webinar over to Henry Moeller, who will take you through the live website.
And just a reminder to everyone, if you have any questions up to this point, please submit them in the questions box. Due to the number of people who are on this webinar, we won't be doing any live questions. So if you have any questions, just type them into the question box, and then towards the end of the webinar, we'll make sure to get to as many as possible. So now I'm going to turn it over to Henry to do a live walkthrough of Ohio benefits.
Alrighty. Thank you, Alyssa. Good afternoon, everybody. My name is Henry Moeller. I'm the Program Associate with UHCAN, Ohio, and today I'm just going to be going through a mock sign-up on benefits.ohio.gov just to demonstrate the process and hopefully provide a few useful tips to help simplify things a little bit. And to begin, we have been told by the Medicaid office that the browser compatibility issues have been resolved. However, our enrollers and I have noticed that Internet Explorer seems to be the most compatible web browser with the fewest issues, so just something to keep in mind as you go through the webinar. So the sign-up process begins with a brief eligibility check, and for our purposes, we'll be using a fairly simple application, although I know really there's no such thing as a simple application sometimes. So we'll be applying for coverage just for myself and with a one-person household. And again, this is just an eligibility check. It's not anything binding. So we're going to do $1,000 a month for the monthly household income. And again, for our purposes, we're just going to say no to these questions, but certainly you want to go through it with each consumer you assist just to make sure. Okay, and then just to review the important information before you apply, I'm just going to summarize it here. The consumer will want to know their Social Security number to accelerate the determination process. However, you are not required to provide a social if you are not applying for coverage for yourself. If you prefer not to provide your Social Security number, please answer no to the question that asks whether you have a Social Security number. And also, I just want to mention, if you are not applying for coverage for yourself, you do not have to answer any questions about your citizenship or immigration status. And now we go to the application, which should be loading here. Okay, and you'll want to click Apply for Benefits at this point. And so if you already have a username and password, this is where you'll put it in. But we're going to go ahead and create an account just to show you how to do that. So right here, you'll want to click here to create a username. Now this part causes a bit of confusion when you're signing up, just because there are some stipulations around the username and password. The only stipulation on the username is that it cannot use special characters. So I'm just going to use a generic one. And for a password here, I'll just show it to you in the first name box. And I recommend you do not use this password because it's not very creative. but we're just going to go with password 2, just to fulfill the requirements. And for the password, you must have at least 8 characters and contain at least 3 of the following 4 characteristics: in uppercase, lowercase, numbers, or special characters. And for first name, we'll just use Ivana, and last name, Get Covered. And providing an email address is optional. However, they can communicate more efficiently and more quickly if you do provide it. For this webinar, we will not be providing one. The next step that people get hung up on is the security questions. These are just questions they ask if you get locked out of your account and don't know your password. The important thing is not that the answer is necessarily accurate, it's just that you remember it. So I'll actually use my first bet here. And the Buckeyes. And you'll want to go through the terms and conditions. It's actually not as painful as most terms and conditions. It's pretty easy to review. I won't go through it here, but you'll definitely want to tell each consumer that you assist to look at it just so they know what they're getting into. And once you review that, you can check the box and move on to the application. Okay, so this is just a brief overview of what you'll be expecting in the application, what you might need. Notice things like Social Security number, birth dates, employer and income information, policy numbers for any current medical coverage, and information about any job-related medical coverage. And if the client is willing to agree to these terms and allow the website to use their information, you want to click the box and continue. All right, so this is just an overview of the buttons you'll be clicking. You'll need to check these 2 boxes to move on, so we can skip through that. And you'll be applying for health coverage and for Medicaid, CHIP, or subsidized insurance. And note, if you do have any individuals here who need help paying for long-term care, they need medical assistance for someone who's age 65 or older, that's where you'll click here for those cases. But for now, we're just going to continue. Now, one thing I just want to note about the contact information, it's fairly basic. You will need to follow the exact format on the website. So notice the parentheses and dashes. You'll just want to keep that in mind, because if you do not put it exactly as it's shown, it won't accept the answer. Okay, and we'll just go ahead and use UHCAN Ohio's home address here. And if their mailing address is separate, you want to put that in too, but for here, we're just going to say it's the same. And it'll often pop that up. It's just directing you to the postal website they have. We'll continue. Okay, so for this part, one thing I do want to mention is on the do you have a physical, mental, or emotional health condition that causes limitations in activities question, which is right in the middle of the page. So generally speaking, if the consumer is unsure of if they have a physical, mental, or emotional health condition that causes limitations in activities, it's probably best to answer no. This question is to determine if applicants need a long-term care waiver. And we'll just make this up. And we'll provide a Social Security number for all those getting their hopes up. This is not my real one. And for marital status, we'll pick never married. And then the other note I want to make here is even if you have other health coverage, there might be a program with better coverage. Basically what this means is even if you have coverage through work, you can still be eligible for Medicaid. It just has to do with who is the first payer. And then also Medicaid will retroactively pay hospital bills or medical bills from the past 3 months if the consumer was eligible for Medicaid in that period but had not applied yet. I want to make a note there. Newly eligible Medicaid enrollees who are ineligible for the old Medicaid program were not Medicaid eligible until the expansion happened, so their previous bills would be ineligible for repayment. Okay, so for this we're going to select English, and we would like a person who speaks your preferred language. So for this application we're going to pick a citizen, but we know that many people applying for coverage are non-citizens, and while we could talk all day about the difficulties these people face in applying for coverage, for our purposes we just want to remind everyone about the 5-year benefits bar for Medicaid and also the exemptions that go with it. And this means that a legal permanent resident must live here for 5 years before receiving any benefits, and some of the exemptions are refugees and those with certain protected statuses. Okay, and even though it says we're only 1% complete with the application, we're further along than that, so don't worry, and you'll want to remind the people you're helping that, you know, it jumps around quite a bit. All right, so for this, you'll just want to ask the consumer these questions, and we're going to go yes, yes, and no. Okay, and this is just where you review the information. We recommend reviewing it after each section. It's certainly a lot quicker to do it that way than go back at the end and review all the sections. And we'll say this is a single-person household, so we'll go ahead and continue. And this person is not in school. And then I just want to make a note on the next question. Many applicants may be unsure if they'll be working in the next 2 months. Many hope to work. However, if there's not a pending job offer or a concrete job opportunity available, applicants should select no to the question regarding their work plans. And that was just a review page. Okay, so this section deals with what kind of income the person has, whether they receive anything related to Social Security or any kind of benefits. For this purpose, we're going to say no. And they also have no deductions. And that they will file a tax return this year. They will not be claimed as a dependent. And we'll say that their income is not steady. The wording of this question is a little bit weird. Is anyone's month-to-month income not steady? You'll want to hit no. And I just want to make one note about Social Security disability before we move along. We've discovered that previous Medicaid recipients who have monthly spend downs with Social Security disability are not being enrolled into the new Medicaid program. These consumers should file a separate Medicaid application, and there seems to be a lot of confusion at the different Job and Family Services offices regarding this issue, but you will want to file a separate application. So these are just general tax questions, whether they're the primary taxpayer, and again, another review page that we'll just skip for now. This is, again, just a single-person household. I talked about this before, but even if you do have health coverage from your employer, you still may be eligible for Medicaid. And for the question, is anyone incarcerated, we take that to be anyone who's currently, you know, in either a prison or a jail. I will have to double check on things like a halfway house. We're not exactly sure. And again, just another review page. Okay, and then this question is just asking the applicant if they would like to register to vote. certainly we encourage people to ask that question and let the applicant make that decision for themselves. And if you're helping someone with the application, you want to provide the information for you just so they can keep track of who's helping. Unless you're very clearly like a food bank or a health clinic, we've been selecting other type of organization. So just provide that information there. And we can move on to the next step. It's important to let the applicant know which Job and Family Service office the Medicaid application is being sent to, just so they can keep track of where they should be calling. And it's also important if they're someone out of Franklin County that they know that it's a separate Job and Family Services office than Franklin County. And on this page, you can upload documents for things like immigration status, identification, income, but for today, we won't be uploading anything. All right, and this is the last page where someone certifies that all the information is true. They submit their electronic signature here. And I just want to make the note that if you want to do practice applications, you'll want to stop here. You don't want to submit the application. It's a live website, meaning that if you submit the application, it will be reviewed by Job and Family Services. They have no way to tell that it's just a test application, and certainly they're so swamped that we don't want to do that to them. So I think that does it on my end. I'm going to pass it back to Alyssa.
This is Kathleen. I'm going to take the next slide here. Just wanted to mention a few other things about people who are helping those to enroll. As we mentioned earlier, there's no particular certification requirements, but there are some good practices that people should keep in mind. For example, if you're a social worker or lawyer or doctor or whatever, there are certain rules of your own profession that you should apply in terms of how you maintain information confidentiality, et cetera. When you go into the browser, and they're all a little different, there's a way to erase any history in that browser, and then the more important is when you finish with an individual to erase the history, just to make sure that even though you've exited the website, you want to make sure that there's no way anybody else using that computer could go in and find someone's personal information. You don't want to retain the consumer's personal information. You're really just helping them. Now, if you are working with this as an agency and you have particular ways of retaining information whenever you have a client, that's a different issue. But if you're someone who's just doing this, like maybe it's your church and you're trying to help people in your congregation or whatever, then we suggest you not retain information. And in addition, people really should be given the opportunity to enter all of their own data on the computer if they're able to at all. Some people don't feel comfortable at a computer, but if they are comfortable, they should do their own. And you want to make sure that you have a signed authorization from the consumer if you have any intention of doing any follow-up. For example, if you're going to actually go beyond helping them and then try to call a doctor or find them some medical help or something like that, then you would want to make sure you had some kind of a signed authorization to share that information. You don't want to release the consumer's personal information to anyone, not just their birth date and their social, but really don't want to release any of their any information that could identify who they are, such as their address, phone number, even their name. So, Alyssa, I'll send it back to you.
Okay. So we've got one poll question, and the question is about future trainings. We're so glad to have you on this webinar today, but we might hold some webinars in the future. So this just gives us an idea of what information you would like to have webinars on in the future. So would you like to learn more about eligibility criteria, or maybe you would like more training on the benefits.ohio.gov website, or maybe you'd like more information on the responsibilities as somebody who is assisting someone enroll in Medicaid, or maybe some more training on the rules and regulations, including how to file an appeal and more things like that. If you click Other and you have a different topic ID that we didn't list there, just shoot me what you think we should hold the webinar on in the questions and comments box. Or there's a survey that is following the webinar. You can put any improvements to this webinar or any other topics you'd like us to have webinars on in the survey after the webinar. So I'll close the poll, and it looks like most people want to hear more about the eligibility criteria, and we will definitely take that into account as we decide to host more webinars. So I'll hide those results. And we will continue on with closing tips.
Okay. So just sort of, this is like kind of a quick summary in a way. Determining eligibility for Medicaid mostly follows the tax filing group, but there are certain exceptions which we described above. You don't need to file a tax return to be eligible for Medicaid, even though those questions get asked in the benefits.gov application. There is no asset test for the MAGI groups. That includes the newly eligibles, but they are subject to estate recovery. I might just add that that's not something we are particularly telling everyone as a matter of routine. However, a lot of people do have concerns like, well, what about my house, or how can I be eligible for Medicaid because I own my house or whatever. So we do feel it's important to tell them at that point that, there is this recovery provision, but it wouldn't be until after they had died and after their surviving spouse had died, and even perhaps some other family members who might meet certain waiver criteria. And you want to make sure that the consumer has the contact information for the local job and family services that will be handling his or her application after completing it online for follow-up purposes.
Okay, now we're going to open it up for questions. If you haven't submitted a question already that you would like an answer to, please submit it in the questions box, and we will get it answered to the best of our ability. A couple of you have been asking, will you get a copy of the PowerPoint? We will post a copy of the PowerPoint on the UHCAN Ohio website, which is UHCANOhio.org. Also, I'll be sending a follow-up email to everyone who registered, even people who didn't attend this webinar, with the PowerPoint and the recording, as long as the recording worked and there were no technical issues. So don't worry, we will definitely get that information to you. It won't, however, have the PowerPoint slides that you receive won't have a walkthrough of a screenshot of each application page, but the recording of the webinar will. So hopefully that answers that question.
And this is Kathleen, I just want to mention that we also have with us, besides those who presented, Tricia Brooks from the Georgetown Center on Children and Families, who will also help with answering questions.
Okay, we have a question from Mary, and her question is about what qualifies as income. And her question is, does an AmeriCorps living stipend count as income?
I'm not sure. Tricia, do you know? Or
it's my understanding that educational awards and scholarships that are used for tuition purposes are excluded by virtue of the fact that it's specific to tuition-based. I believe the stipend would be, but we will do a double check on that and make sure that's one of the things that gets out to folks on follow-up.
Great, thank you.
I think if I can just add that the general rule of thumb when you think about income is anything that you would have to report for tax purposes. Now, of course, Sometimes those stipends are low enough that potentially they don't reach the tax filing threshold, but anything that would be reported on taxes would count as income.
Okay, we have a question from Karen, and her question is about what is covered by the new Medicaid expansion, and specifically is asking, is mental health services included?
This is Kathleen. I'll just jump in and say yes. And really, anything that's been included in benefits is still concluded for this expansion population. The one issue with mental health is sometimes whether certain providers are reimbursable or not. And so, you know, when you're talking about a psychiatrist, a psychologist, a social worker, you know, there is reimbursement. Then you get into like peer counselors and other kinds of counselors where one would have to check to see whether or not that particular service is reimbursed. And I don't know if there's anyone else who wants to add to that.
Okay. We have a question about the 30-day time frame. How does that work if you're missing information, or is there anything that affects that 30-day time frame from when you should hear back about whether you qualified or not?
This is Deanna. So before, after you submit an application, if the agency cannot get the information that it needs from the from pinging the hub or from the federal data match sources, the applicant should receive a verification checklist. If you want to be technical, it's called a 7105. That's the number that appears in the bottom left-hand corner of the checklist. And the checklist outlines all of the information that the agency needs to make a timely determination, and it should have a deadline of 10 days for the applicant to return the information. So in order for the agency to make a determination, the applicant should get that checklist by day 20, because the deadline shouldn't go over the 30-day timeline that it requires to make a timely decision. If the applicant is causing the delay, if the applicant is not getting the information back in, then the agency can't make the decision within 30 days. I want to differentiate that from the applicant saying, I can't get that information to the agency and saying, I need your help. So if the agency says, hey, we need you to prove that you don't work at Kroger anymore because the IRS is telling us you still work there, and the applicant says, hey, you know what, I don't know, my employer never fills out these forms, I don't have any way to get up there, or my manager hates me and won't fill out this form, then the responsibility transfers to the agency to assist the consumer in obtaining the verification. So there's a big difference in the regulations about the failure to cooperate versus the unwillingness to cooperate. So I don't mean to muddle the waters here, but they have 30 days to make the decision, which includes the collection of verifications.
All right, thank you. We've got a couple more questions. Thank you for all these questions. Hopefully we got about 20 minutes left, so if you have any more questions, please remember to submit them in the questions box. One question from Leslie is, will the topic of presumptive eligibility be addressed on this call?
We weren't planning to address presumptive eligibility. I think that if we could understand what the question is, a specific question, we would certainly try to answer it. Maybe the questioner wants to write back in with a clarification on what the specific question is.
Okay, I'll look for that, and we'll answer a couple more. A question from Pamela. She asks, how will Ohio handle repayment with assets under Medicaid expansion, and when will that go into effect?
This is Kathleen. We don't really know, and this is something that some of the advocates are actually going to be working on to try to find this out. Right now, I'm not aware. Well, I'm not aware of any specific rules that have been issued or any kind of guidance as to how it will be done. I think one of the things that's important, though, for advocates and people who are helping people to enroll is to make sure that they understand how important it is to seek Medicaid and to get the health care they need. Some people, especially as they are getting older, are very concerned about having something to leave to their children. And I think we need to make sure people understand that, first of all, after they've passed away, the surviving spouse is taken care of. And if there are children with disabilities or minor children, there are some protections for them. And so it's really important for the person to go ahead and apply for Medicaid and get the health care they need.
All right, we've got a couple questions about actually helping to enroll someone online. Lacey asks, does a case manager need a different username for each client? Well, let's answer that one, and then I'll read the next one.
Zach or Henry, do either of you know the answer to that?
Sure. Can you repeat the question again, Alyssa? I want to make
sure.
sure.
The question was, when somebody's helping someone enroll in Medicaid, do they need a different username for each client?
Yes. The benefits.ohio.gov is a self-serve system, and the self in this case is the applicant. So each applicant must have their own user account in order to file an application.
Okay, and to follow up on that, Pamela asks, if spouses are both applying for Medicaid, can they apply under one username?
Yes. The lead applicant in a household, the primary applicant in a household, should create the user account and then include all other members of the Medicaid household on their application.
All right, and one more question along those lines. Can this self-service enrollment be used for individuals living in long-term care facilities? Mary asks that.
I don't believe that this application can be used for that, but this is Kathleen. I'm not sure. Maybe one of our other panelists is a little more certain on that.
Okay. We've got a question from Vanessa who asks, how does the Medicaid expansion affect clients on spend down, and do they need to submit a new Medicaid application?
I believe that they will need to submit another Medicaid application because they've been found eligible with a spend down, at a previous time, and they haven't been found eligible as a new Medicaid eligible. If any of the other panelists has any other thoughts on that, that would be great. But that's what I think.
Yes, just to add to that, Henry did indicate that people on the spend down were not being automatically enrolled in the other program and needed to file a new application.
And I'll add a piece here. As we understand it, the IRS does not consider the spend down program to be minimum essential coverage when it comes to fulfilling the individual mandate that you have insurance. Now, that rule is not final yet, and there is the slight chance that the Secretary of Health and Human Services at the federal level could decide that spend down programs meet that requirement. We're not anticipating that that's going to happen. There won't be a penalty for folks who choose to stay in spend down rather than going for full Medicaid or going into the premium tax credits in the marketplace. But people should be aware of that caveat that in the future, starting in 2015, spend down is not going to count as you having insurance, and you could be penalized for that.
This is Deanna. To be real explicit, we're getting some feedback that folks are being told that they're not eligible for Medicaid expansion because they're on Medicaid for the disabled with a spend down, and that's not true.
All right, thank you. We've got about 15 minutes left, a little less than that, so if you have any questions, please submit them in the questions box. We have a question from Gail that asks, how do people apply who maybe are homeless or don't have access to a computer?
This is Zach, and I'll jump in there. First of all, individuals that are homeless can apply the same way as anyone who is housed, but to access a computer, they would need to either go to a public space with a computer with internet access available. They could also request the assistance of a navigator or CAC organization to help get over the barrier of access to the internet and any other computer or other barriers to completing that application. They could also go to the County Department of Job and Family Services. We do have some specific feedback from County Department of Job and Family Services workers explaining that at this point it's really critical. I'm not saying that it's required, but it's really critical that an individual have a mailing address so that they can get that Medicaid card out to the consumer. And I'll just defer to other panelists if they want to talk more about that. But good to talk with your homeless consumers about using a local shelter, a friend's or neighbor's house, or another reliable mailing address on their application.
They can also walk into a federally qualified health center. Every federally qualified health center in the state has received funding to have application counselors on site that don't just help their own patients.
All right, thanks. We've got a question from Angela, and she asks, when do the 2014 federal poverty levels take effect?
This is Kathleen. I actually tried to find that out myself, and I haven't gotten an answer back yet. Basically, the 2014 poverty levels were posted in the January 22nd Federal Register to take effect immediately unless specific programs have other effective dates. Now, we know that for purposes of the marketplace, the advanced premium tax credits to buy an individual health insurance plan, the 2014 poverty levels will not take effect during this open enrollment period, but rather will be used starting with the next open enrollment period in November. But with respect to Medicaid, I do not know if any other panelist has had a conversation with anyone from the state Medicaid, and or if any of the local offices that we know there's some folks who are part of this, you might submit it as a question, but just it would be what you've been told about when they'll take effect.
So I can add something to that. Kathleen, this is Tricia. It is our understanding that the federal marketplace will be loading up the 2013 levels, the new 2014 levels in about a month. And at that point, if someone applies through the federal marketplace, their eligibility will be determined based on the 2014 levels. For Medicaid, for what Ohio may be doing, There is no specific requirement that for a date that Medicaid adopt the new FPL levels. They are expected to adopt them. I believe that states are waiting for more guidance from CMS in terms of whether CMS might choose to say you should sync up your adoption with when the FFM is, so that we don't have, two different situations going on. We are expecting something to come out of CMS very shortly in this regard. So I do think you'll find that sometime in the next, perhaps month to 6 weeks, that these will be in place.
All right, thank you. We've got a question from Melissa, and she asks, is the estate recovery applied to individuals age 55 and older only?
Yes, for some reason, that's the way I think that's a federal law that's, that is simply being implemented in Ohio. So if you're 55 or older and you're getting medical services, then it would be applied.
All right, Karen has a question about income. She says, if a person has no place to live and is temporarily living with a friend or family member, do they have to count the income of the person they're living with as their income?
Do you want to take that one, Trish?
Well, I can take part of it, but it's
okay.
something maybe Ohio-specific that I don't know.
Okay.
No, they are not, there's not a household relationship. For Medicaid purposes, that individual is not related to the people that they are living with, so they're not counted in the household. States still have an option to count some of that as cash support as income, and I don't know whether Ohio is doing that or not. So it would not be the individual that they're living with their full income. It would be what that person might be giving them. So that's another one we can double check on to know specifically how Ohio might be treating any cash support that that person is receiving from the household they're living in.
Alyssa, this is Zach. I'm wondering if you can give me control of the webinar so I could point to some resources that are available straight from benefits.ohio.gov that'll be helpful to answer a lot of these questions after the webinar.
Are you logged in as Henry?
I am.
Okay. I can.
Great.
And while we're doing that, Zach, I will just say that I was checking online as we were talking, and AmeriCorps living stipends are considered taxable income, so they would have to be reported for as income.
Excellent. Thank you. So on this website, if you click Frequently Asked Questions, you'll be transferred to medicaid.ohio.gov, which is the Department of Medicaid's primary website. And from here, there are a lot of questions that you may have and a lot of questions that your client may ask throughout the process of filling out the application. For instance, where can I access Medicaid's paper application? I already received Medicaid. Do I have to reapply? And then somewhere on here, there is a link to a series of, actually, right over here, publications. If you click fact sheets, there are a lot of fact sheets here that I found very helpful to answer clients' more in-depth questions. And here I'll just click on a fact sheet about the estate recovery question because we've had a lot of questions. Looks like we don't have the right Adobe on this particular computer, but I would strongly recommend spending some time looking through that website. And again, if you need to watch the tutorial, you'll just click on how to use this site. you'll have to click these words, how to use the Ohio Benefits Portal. And then it says, click here to view the tutorial. You'll click the word here to launch that tutorial. So just wanted to quickly show you how to access those additional resources.
Okay, we got a couple more minutes. Looks like we got a couple of the same questions, so I'm just trying to, just getting some clarification on reasons that an application would be quote-unquote legitimately declined, and a couple questions about if someone indicates that they're detained or incarcerated, does that mean they're going to get denied?
This is Deanna. I can speak to reasons an application would get legitimately denied would be that you were truly over income for the program, you didn't meet the citizenship or qualified alien test, you didn't meet one of the categories for eligibility based on your citizenship or immigration status, or if you failed to cooperate in returning the verifications that the agency needed to make the decision, and you didn't ask for help or indicate that you were having trouble getting the verifications. If there was just radio silence, you ignored the checklist and didn't get anything back to the agency or asked for help. I'm going to have to defer to somebody else on the incarceration piece of that.
I think the part that we're all struggling with a little bit is when someone goes into a local county jail, and I think there have been some changes lately, and we're just going to have to look at that and get back to people about it. And we know clearly once you're in prison, you've been convicted, you're in prison. You know, the state of Ohio is then responsible for your medical care, but the places where we have the difficulty is that pretrial detention in a jail, or you know, once you've been released and paroled, but you're still being detained in some kind of a facility.
Okay. How does a person who has disabilities, if they select that they are disabled or have disabilities, how does that affect their application?
We're not exactly sure. I have not, and Zach, maybe you've had this experience. I haven't walked anyone through that, you know, as to see exactly how it's treated at the local level. And I have encouraged people, unless they really have a disability, because it sometimes says, you know, need help with chores, and we've had people who are employed, but they say, well, I can't really do my own vacuuming anymore. Well, you know, we've generally said, well, it's probably best not to then say that you have a disability. So the question, I think, is whether or not the department uses that as a tool to see if the person is eligible for other services, or whether they use it more to give them that choice of, you know, applying as a person with a disability and a spend down, or as a newly eligible. And in that case, they would have to know that they can meet the disability test if they're going to, if it's for purposes of having Medicaid with a spend down.
All right, one final question as we wrap up here. A point of clarification on the spend down eligibility levels chart that indicated it was 74% of federal poverty level. This person thought that it was 64%. Can we just clarify if it's 64 or 74?
I may have made a mistake. I will check that.
Okay. All right, let me just double check, make sure there are any pressing questions that we haven't answered yet. I guess one last question is, what do people do if they're getting denied by Medicaid because they say they're over income, then they apply at healthcare.gov and it tells them that they're eligible for Medicaid?
Well, this is Kathleen, and I know that has been a big problem for a lot of people. At a recent ONCE meeting, one of the individuals from the state reported that HHS was trying to put together some kind of a conversation, between the feds and the state, like on a one-to-one basis, which I think everyone recognized would be really difficult to make that happen. If any of the other panelists have some other information on what's now being done, please share it.
This is Zach, and that's the guidance that our navigators have received in that situation.
Okay.
It's my understanding that today the Department of Health and Human Services was going to announce some potential steps to remedy some of these situations. I have some concerns about trying to figure out, and I'm sorry, we're getting feedback from somebody who's on an open mic, and it's kind of hard to even hear myself, but we believe that there could be errors in how income is either being reported or counted on the state level. So, for example, there have been some significant changes in self-employment income and depreciation that previously was not deductible, but is now, and therefore the countable income is lower and people are eligible for Medicaid that previously haven't been. The other thing is that individuals report income that may be lower, higher than it needs to be because they contribute to a retirement plan. So I think it's really important for someone to get help from a knowledgeable person that understands eligibility to try to figure out what they really should be eligible for, and then go either to Medicaid or to the FFM to appeal that decision. So that's a lot to say, but it's just not clear to me that we are always able to figure this out without taking a hard look at individual situations.
Alyssa?
Yes, it sounds like there's a TV or something going in the background.
Yeah, sure.
Yeah, I think some people who just called in, unless they muted themselves, their line is open. So I just want to thank everyone for participating in our webinar. Thank you for all the wonderful questions. If we didn't get to your question, there is a survey at the end of the webinar, and there's a question that asks if you would like us to follow up with you. Please check that and include some information about what your question is, and we'll be sure to get back with you. Since we did have some technical difficulties, we will be hosting this webinar again. If you're on the ONCE list, you'll get information that way. Also, we will send it out to the people who all registered for this webinar, which was around 430 people. So we will be hosting that in the near future, and we'll announce that date very soon. Is there any last words our presenters would like to share before we log off for the day?
I will just say we got word that the FFM is loading up the 2014 federal poverty levels, and we'll start using them on Monday.
Oh my gosh, that's wonderful. Thanks, Tricia.
Mm-hmm.
I would suspect then that Ohio will start using them very soon.
Yeah, as soon as they can get them loaded, it makes the most sense.
Yeah.
All right, well, I just want to thank all of our presenters for taking time to present today, all of our participants for taking time out of their schedule to listen in. We hope this webinar was helpful. We will send a follow-up email with the PowerPoint recording of this webinar. And thank you all for being here. This concludes our webinar, and we hope that you have a great weekend. Thank you.